Welcome back to The Vine. This month is Maternal Health Month, and when it comes to pregnancies, there are some dental health concerns that you should know about too. And Tanielle Price with Delta Dental of Arkansas is joining us to share more on this topic. So we're glad to have you here.
Thank you.
There are things that we need to know, and there's this old wives' tale about losing teeth during pregnancy. What is that exactly?
Well, because of rising hormones and then also a little bit more predisposition to not caring for yourself as well, there's more of a prevalence of periodontal disease, tooth decay, and other issues during pregnancy.
Right.
So there's a small amount of truth to it. I think in our time of modern oral health care, though, that's significantly less than it was before.
And there are some people that are just, they have bad morning sickness, and so that can play into it as well.
Good call out. A lot of acid from vomiting or even acid reflux can cause issues with the teeth as well.
Every time that I would brush my teeth when I was pregnant, it would make me want to vomit. I know that's
I had
TMI.
to hold my breath, so it's not TMI. I think that's good for a lot of people to hear, because just to hear that that could be normal. Yeah, it really could be.
Yeah, it's just one of those weird things that you don't expect with pregnancy. So there is something to that old wives' tale, but untreated dental issues, I mean, it can even impact your baby.
Yeah, it could. It could. I think in some ways people assume that it's going to affect your baby's teeth, but it actually affects your baby through the effects on the mom. So there's more of a predisposition to things like heart disease, low birth weight, and even some studies have shown miscarriage is a possibility from bacteria in the oral cavity.
It's crazy how all of these things are affected during your pregnancy. What are some things that we can do while we're pregnant to make sure our baby is healthy, to make sure that we continue to keep our smile in as best shape as possible?
Well, one of the first things we can do is be aware of our original status of our mouth. So just being aware of like what's normal in your mouth, so you know what's abnormal. I think communicating with your dentist is another really good one. Let them know that you're pregnant. Don't hide it or like stop going. Right. And then a lot of people don't realize that pregnancy is a medical condition in which your insurance company many times will give you an extra cleaning and preventive visit.
No, I had no idea. Yeah, that is really good information to know.
Yeah.
Okay, so yeah, make sure that you ask about that and get that extra cleaning in. I think sometimes we're thinking, oh, I'm going to the doctor so much. The last thing I want is another appointment, but it's so important.
Yeah. Because sometimes your doctor will also notice things you won't. So we see that as a dental hygienist, I might see inflammation and you might not notice. So.
Right. All right. This is great information. Make sure that you find out more about that by going to the Delta Dental website. There it is on your screen right now. You can also give them a call or follow them on social media. And Tanielle, we appreciate you today.
Thank you.
Yeah, for sharing all of this. Thank you so much.
Yeah, no problem.
Right. The Vine will be right back.